Hello, this is Dr. Mustafa Göğün from Istanbul, Turkey. We would like to introduce you the new advantages of BioGlue cyanoacrylate therapy for sphenomagnum reflux. I would like to compare the advantages and disadvantages of both the laser and radiofrequency therapy with the cyanoacrylate BioGlue ablation of the sphenomagnum. First of all, we do not need to use any kind of anesthesia, either spinal or tumescent, for the cyanoacrylate ablation for the venous sphenomagnum reflux disease. But on the other hand, as you know, for the laser and radiofrequency therapies of the venous reflux, we need to use spinal or tumescent anesthesia in our patients. This necessarily puts forth the need for operating room environment for laser and RF therapies. But on the other hand, as an advantage, you do not need any kind of operating room facility for the BioGlue vena block ablation of the vena sphenomagnum. The recurrence rates are nearly same according to my experience, which covers more than 1,000 patients, both laser, RF, and BioGlue. And on the other hand, another disadvantage of laser and radiofrequency is procedure time. Procedure time is very long during lasers and RF therapies. For this, we need to choose BioGlue, which takes only 10, maybe less minutes to complete. The BioGlue patients, cyanoacrylate ablation patients, can walk away the clinic in 10 minutes, 15 minutes. Compared to laser and radiofrequency patients. These patients, as they are under any kind of tumescent or spinal anesthesia, most of the time we need to keep the patients and observe the patients in the surgical ward. Another advantage is you don't need any kind of high-tech, high-cost technological lasers or RF generator equipment. With BioGlue ablation technique, you can do the procedure by yourself in your office setting without investing any kind of high-cost equipment. Patient stay is very short, and there is no energy load for the tissues. For laser and RF, you are putting in some kind of energy into the tissue, and skin burns, lipid burns, and hardness on palpation can be encountered in some patients. But in BioGlue technology, vena block technology, we just put a sheet into the vein, the diseased vein, and ablate the vein instantly in 1 minute, maybe less than 1 minute, and patient can walk away. Especially according to my experience, very large caliber veins, when larger than 10 millimeter, for example, the cyanoacrylate ablation is much more successful compared to laser and RF patients. Most of the recolonizations I see during my 5-year experience were in sphenomagnum diameters larger than 10 millimeters. But especially in the cyanoacrylate ablation, BioGlue ablation technique with vena block technology, the recolonization is nearly never ever encountered during 5-year period. This was a very huge advantage, I think. There's no ecchymosis and no burns, no hardness on palpation, no pain on cyanoacrylate ablation. This is another advantage. As you know, for the laser and radiofrequency therapies, in general, most of the patients are coming in 1 week with ecchymosis. Another advantage is stump opening. Stumps are sometimes becoming reopened, recolonized, just only to stump the 10 centimeters of saphenopharyngeal junction. But in BioGlue technique, vena block technique, I don't encounter any kind of stump opening. And lastly, the advantage is this is a single-use product. Unfortunately, not everywhere, but in most of places on Earth, the lasers are reused. We only use BioGlue cyanoacrylate in only one patient. There is no option for reuse. This is another advantage of vena block cyanoacrylate technology. Thank you very much for your time.